Good afternoon, everyone. This is Christine at Health Current. I have Connie Ide, our Director of Programs, with us today. We are going to be starting today's EPCS webinar, Practice and Prescriber Readiness. Just a reminder that all lines are muted during the webinar, and to please use the chat feature to pose questions during the presentation. Today's call is being recorded, and the presentation will be sent to attendees following today's webinar. Thank you so much for joining us, Connie. I will turn it over to you.
Thank you very much, Christine. Hello, everyone online. Thank you for joining. I'm excited to be able to share a bunch of information with you today. A lot of the information is information that you have been waiting for and looking for. So without any further ado, let's get going here. I do want to give credit to a few other organizations who have a shared commitment with Health Current, which includes Access, the Arizona Healthcare Cost Containment System, the Arizona Department of Health Services, and the Arizona Board of Pharmacy. We grouped together to be able to provide this Click for Control webinar series so that we can help you all get compliant with the mandate by the end of the year. A few things that we're going to cover today. I want to talk to you about prescriber for practice readiness. That's what the main content of this webinar is about. I also will let you know a little bit about vendor readiness, where other vendors are within the state of Arizona, and what you might want to know about it. I'm going to do quite a bit about the EPCS regulations and mandates so that you have an understanding of what's required of you as a prescriber. Also, we will talk about a little tiny bit about where Arizona is in the national landscape, and it's just something exciting for me to share with you there. We also will talk about the CSPMP mandates and access. That's the controlled substance prescription monitoring program that you are mandated to participate in if you are prescribing controlled substance Schedule IIs that are opioids. We'll also talk about common barriers to EPCS so that you know you're not alone if you're having a few little problems with getting going. And we'll talk a little bit about the benefits so that you know what you're going to get from it. And also, I want to share with you some Click for Control campaign resources. So let's talk about prescriber and practice readiness. In a nutshell, you need to contact your EPR or e-prescribing vendor. You need to complete identity proofing requirements. You need to obtain two-factor authentication devices and process. You need to set up access controls and also adjust your workflow and then just ultimately go live with EPCS. So let's dig in a little bit to these 5 points. First of all, the reason I tell you to contact your EHR or e-prescribing vendor is because you want to verify that the software is certified and approved for EPCS. The DEA approves the software that can be used for EPCS, so you want to speak with your vendor and make sure that they are certified by DES to be able to provide you with software. Also, you can, if you also want to, you can go on the SureScripts site when I've offered you the click. You can click on the UHL. I'm having a hard time with talking here. The URL to be able to get to the SureScripts site. SureScripts is a national company that focuses on e-prescribing and prescriptions in general, and a lot of other things as well. You can click on this link and it will take you to where you can verify that your software is certified, but I still would ask the vendor for a document to verify that it is EPCS certified. Then discuss with your vendor the software pricing. There will be one-time as well as annual and ongoing fees, so you want to talk about the pricing with them. You also want to determine what your hardware requirements are. Do you need PCs, tablets, smartphones? What is it that you need to be able to run their software? And then confirm the steps to implementation with your vendor. They will be doing a lot of bringing people up live on the system in the state of Arizona as well as nationally. So you want to discuss a timeline with them and any contingencies that might be there that might stop you or delay you. So you want to know what those are going into it. Also, when you contact your EHR or e-prescribing vendor, make sure that you talk about the costs with them. As I said earlier, there are one-time and setup costs, and they usually range between $100 and $250 per provider. Make sure you cover over so that you're prepared for that price, that cost. Also, the annual ongoing cost can range from $75 to $250 per provider per year, and those will repeat every year. And that would probably and most likely with everyone cover your maintenance fees and your call-ins and assistance if you get into difficulties. Also, on our website, on the Health Current website, the link is provided there for you. We've done some research and looked up some costs for you so that you can figure out by vendor what it may cost you. However, it's very difficult to get prices out of the vendors, so this is a guide. It's not exactly what it will be, and the cost sheet was prepared in 2018, September of 2018. So it's about a year old, so you want to make sure that you discuss the costs with your vendor and not just go on what's on that site. If you don't have an EHR or an e-prescribing system, consider what you want to procure on the timeline to choose a system and implement and so on. As I said before, many providers in the state of Arizona, to meet the mandate of 2021, January 1, 2020, will be working with providers, with the vendors, and so you want to make sure that you get in their schedule. Also, there are others that are nationally working with the vendors as well, so make sure that you get in their schedule. Time is running out. We're already in third quarter here. Some other things that you need to do is complete identity proofing requirements. And what this is this is just so that you can tell the DEA that you are who you say you are. And different vendors use different companies to do it, so you need to talk with your vendor about how their particular situation does it. Sometimes it's completed online, sometimes it's done in person. The larger systems like the Banners of the world will have someone in some of their like medical records department or their certification department will go have you in person be able to identify yourself. There will be a series of security questions to prove your identity, and you'll also need some documents, some government-issued documents, photos, your medical license, and also electric bill or bank statement, something to confirm your personal address. This is not your company address. This is your personal address. It's because you are being identity proofed, not your practice. The other thing I want to tell you is be prepared to be asked some questions. I've heard of folks who were not able to pass the identity proofing because they couldn't remember some of the questions like what kind of car have you financed at such and such a bank, or have you had a mortgage with someone. So, and also addresses that you've lived within the past 5 years, so be prepared for that. Also, you have to obtain a two-factor authentication device. And what is that? It actually proves the prescriber is authorizing to digitally sign an electronic prescription. And so you will need to be using two of the following items. Something that you have, like a hard token. And you can see pictures of those on the bottom of the screen here. Sometimes they are a biometric, which is a fingerprint or eye stamp. Sometimes they're a password or a PIN that you know. And sometimes they're a hard token that provides that PIN or password to you. And I'll give you a little update here on one of the devices that you can get, like the key fob type devices that you would need to carry with you. If you practice in multiple locations, you might want to make sure that you have an extra one so that when you go from one of your office locations to another, you have it with you. I've heard of folks leaving it at the opposite office because they're practicing in on a day and we're not able to do an EPCS prescription. Also, you will need to set up controls within your system so that only designated prescribers can prescribe the Schedule IIs on your system. And you need two people to do that. One is the person who's actually going to be doing the prescribing, and someone else to confirm the identity of that person. And when I have on the screen here the DEA registrant, that means the person who will actually be doing the prescribing. Also, I strongly urge you to adjust your workflow when you go live with EPCS. If you sit down and write your policies and procedures, you'll have an easier and better time. And also, if you start with a provider who you know is quite adept to using a computer, you might want to start with them and not do everybody at the same time. Get one person going and up and able to prescribe, and then move forward with the rest. But be sure that you do write your policies and procedures, because if you don't, you will run into, you have the possibility of running into a lot of problems with forgetting about certain steps that you might want to do. I also would urge you to consider doing a patient brochure to educate your patients. Because if you think about it, in the past, they're used to walking away with a prescription on paper. So you're sending them away when you're e-prescribing with nothing, no paper. So if you do a brochure for them that reminds them that all they need to do is go to their pharmacy to pick up their prescription, they will have a better understanding of it, and they also will understand the value to them that they no longer have to go to the pharmacy, hand the prescription to them, and sit down and wait while it's filled. They will be ready to go by the time they step foot into the pharmacy from their prescriber. Also, schedule your go-live with your vendor after you have all these steps completed. Remember what I've been telling you all along, especially now that we're in third quarter, be prepared for your vendors to be backed up. A little bit more about vendors as we move forward. So let's talk about vendor readiness. Most of the vendors, these are the vendors that have the largest footprints in the state of Arizona. So you might want to make sure that if you're not one of them, that you find out if your vendor is able and ready to put you up on EPCS. Also, be sure that you understand what the vendor is required of you and understand what their control, where they are in their implementation schedule, so that you're able to get into their schedule and get up and live and operational by January 1 of 2020, which is rolling quickly. One thing I wanted to say here is everybody on this screen is EPCS ready, but I also wanted to remind you that I've heard some issues with Greenway. Greenway is a great company. I'm not saying they're bad. I've just heard that they've had some issues with getting things ready, so you might want to talk with them if they are your vendor. Also, you can go onto the SureScript site, and I've given you the link again at the bottom, and look up your software and be able to tell if they are EPCS ready, and if you can get into their schedule, you would need to call them for that. But this is an option for you to check on your vendor, but then you also want to go and call your vendor and talk with them directly. Now, the next part of this presentation, I'm going to talk to you about what are the requirements and regulations for the mandates. What was in the mandate that Governor Ducey signed? First of all, let's take a look at the regulation and mandate timeline. In 2010, the DEA permitted pharmacies to receive, dispense, and archive electronic prescriptions for controlled substances. And then in April of 2012, Arizona's then Governor Janet Napolitano signed into law making it legal for EPCS in the state of Arizona. And then in 2019, Governor Ducey signed Senate Bill 1001, which was called the 2019 Arizona Opioid Epidemic Act, signed that into law. And then in January of 2019, the State Bill 1001 was signed in 2018. And then in 2019, Governor Ducey signed House Bill 2075, which extended the deadline for opioids to January 1, 2020, and for all EPCS prescribers. If you remember, there were some things in about states with counties within the state with high volume population were different go-live times than the smaller counties, and there were some other things in there. For example, a waiver that was removed, no longer a waiver. Everybody needs to be live by January 1, 2020. So let's talk a little bit about some of the mandates. Here's some of the mandate updates. Prescribers may write and fax a Schedule II controlled substance that is an opioid if, and I know a lot of you have been waiting for this, if you've read the bill, House Bill 2075, you will be familiar with this, but I also want to point out that on the bottom of every one of these screens, I've given you the House Bill 2075 link. If you click where it says here, it will take you to the actual document that you can read for yourself, and I urge you to do that. I'm giving you an update on what's in there, but you need to figure out for yourselves what you need to know and what you need to do. You can, prescriptions can be written to be filled outside of Arizona. The prescription for medications that require compounding of 2 or more ingredients can be written or faxed. And also medication that is not in the e-prescribing database can be written or faxed, I should say. And also medical assistance treatment, the MATs, for substance abuse can be written and or faxed. More of the updates, prescribers can write and fax a Schedule II controlled substance that is an opioid if it's to a Veterans Administration, a health facility at a military base, an HIS, Indian Health Services, and my system does not like me to write IHS, it changes it to HIS, sorry about that, or if it's a tribal-owned clinic. And this is any federal facility. You are not required to do an electronic prescription. You may write and or fax it. Also, you may write and or fax original prescriptions for controlled substances to be compounded for direct administration to a patient. And most of the time I see this as a parental or intravenous, intermuscular, etc. This is because a lot of pediatricians do compounding because they want to be able to actually administer the drugs to the patient while they're in their office. Also, you can write or fax for a resident of a long-term care facility, and also a patient who's enrolled in a hospice program. And it must be a licensed by the state of Arizona hospice program. And you must note on the prescription that the patient is a hospice patient. Also, prescribers may write and or fax a Schedule II controlled substance. If it is if the prescriber's EPCS system or the pharmacy management system is not operational or available in a timely manner. So what you need to do then is indicate on the written prescription that your system was not operational or available, and I advise you to write the times and dates, and I also advise you to keep a book or list or somehow document listing when your system was down and when it came back up so that you can prove it if you're licensing bureau or someone from the state asks you about it. Again, make sure that that you indicate which system was down, whether it was the prescriber's system or the pharmacy system, so that you can document it. Also, you need to keep track of emergency quantities that you might do, and you can do those even orally if it's an emergency situation. Again, you must make sure that you write all these things down and keep track of it. The prescription, if it is orally prescribed to a pharmacist, the pharmacist must immediately write it so that it's on paper, and then within 7 days, the medical practitioner who prescribed it must write an emergency oral prescription and manually sign and get it off to the dispensing pharmacist. Or an electronic prescription order may be transcribed to the dispensing pharmacist, either one of those situations. Prescription orders for controlled substances cannot be refilled. Any oral prescriptions cannot be refilled. Additional mandates, some other things that are in the in House Bill 2075. Prescription orders can only be dispensed up until 90 days. So no Schedule II opioids can be dispensed after the date, with 90 days after the date the prescription was written. Pharmacies may sell and dispense Schedule II substances that are prescribed by a medical prescriber that are located in other Arizona counties or in another state. So in other words, if you're in Maricopa County and a prescriber in a different county within the state sends you a prescription, if your pharmacy is in Maricopa County and a prescriber in another county sends you a prescription, you may dispense it, you may sell it. Also in another state. However, the prescription must be issued according to the state law and federal law, the prescriber's state and federal law. I'm going to talk now a bit about certified physician assistants. And the reason I'm doing it is because in the original Senate Bill 1001, there were some errors in there. If you're a physician assistant, you know what I'm talking about. So I want to make sure that you understand what is covered in what House Bill 2075 corrected. Physician assistants may not prescribe without delegation by a supervising physician, board approved, and DEA registration. So you must be board approved and have a DEA registration, as well being supervised by a supervising physician. Prescription privileges with delegation, you can do a 30-day RX for Schedule 2, 3, 4, and 5 that are opioids. Also, you can do a 90-day RX for Schedule 2, 3, 4, and 5 controlled substances, and also a prescription-only medication. So that's the regular, not opioid or controlled substance. And again, down on the bottom, I've given you the link to House Bill 2075 so that you can take a look at it and see what the actual document says. I've, of course, distilled it here so that we can get through talking about it, but you might want to read the actual verbiage. Also, a board-certified physician assistant may not prescribe without delegating super the board of again. Prescribing privileges with delegation, again, the 30-day, the 90-day, and prescription-only medication. Board-certified physician assistant limits cannot prescribe medication intended to perform or induce an abortion. That would be any certified physician assistant that is operating as a midwife would need to pay attention to that one. cannot prescribe controlled substances more than 5 times in a 6-month period for each patient, and cannot prescribe controlled substances that are opioids are refillable without written consent of the supervising physician, and cannot prescribe prescription-only drugs refillable for a period exceeding 1 year. And again, I urge you to read House Bill 2075. Board certified physician assistant limits and requirements also. A physician assistant must complete 45 hours of pharmacology or clinical management, drug therapy within the past 3 years, and that usually happens when you're getting your license or relicensing, or is certified by a national commission on certification of physician assistants. Also, issue prescription orders for controlled substances under their own DEA number. You must do that. You may not prescribe Schedule 4 or 5 controlled substances more than 5 times in a 6-month period for each patient, and you must have supervising physician written consent. Again, we've talked about that, and you may not prescribe prescription-only drugs to be dispensed for a period exceeding 1 year. Pharmacists, I've included this in here. We normally don't have a whole lot of pharmacists on these webinars, but I wanted to include it in here because it gives the prescriber a little bit of understanding of what's going on the opposite end. Pharmacists may dispense handwritten Schedule IIs in the following cases. When the EPCS system is not available, that's either the pharmacist or yours. Also, the RX indicates that the medical practitioner who issued the RX provided care for the patient in a Veterans Administration, military base, the IHS hospitals or service facilities, tribal-owned clinic. Again, those are your federal facilities. I've also included some things in here about veterinarians and MAT, which is the medication-assisted treatments. Veterinarians were required in the original Senate Bill 1001 to use e-prescribing software, but it was discovered that veterinarians did not have enough as many options as necessary to be able to get the software. It wasn't widely available, so it was changed so that veterinarians are exempt from EPCS until the Veterinary Examining Board feels that there's enough software availability out there. Also, a prescription order for Schedule II substance for MAT does not need to be electronically sent. We talked about that before. That's the medication-assisted treatment for opioid addictions. So I'm sure that you will have several questions in your mind even after I've spoken with you about the mandates and requirements. So I urge you to go ahead and look through the 2075 bill so that you understand what's necessary. Call me if you have questions about it. I'm happy to help you. But let's talk a little bit about Arizona versus the national landscape. This is kind of exciting for me, and I think it'll be exciting for you. According to the SureScripts 2018 National Progress Report, Arizona jumped from number 22nd to the 11th place in 2018. And you might wonder why here we are in the third quarter of 2019, and I'm talking about 2018. SureScripts only produces a report once a year, and it usually comes out in July. So we receive this information. A little more information for you. I'm not going to go over this in detail, but it will show you how things have progressed nationally from 2016 to 2018 for all prescriptions, for non-controlled substance prescriptions, as well as controlled substance prescriptions. And how do we compare, or how does Arizona compare to national? I was able to get some information in August from SureScripts that I could update, so here we go. Pharmacies, EPCS enabled nationally, there were 96%, and in Arizona, 99%, so we're doing really good. So virtually all Arizona pharmacies are enabled. The only ones that are not enabled are those on tribal facilities. Some of the federal ones are not, as well as some of the outlying pharmacies that are in areas that are not able to get broadband. So there are like 5 or 6 pharmacies, if I remember correctly, within the state that are not able to accept EPCS. And then prescribers in EPCS enabled nationally is 40% as of August. In Arizona, we're at 61% already, and I expect that to really start jumping as more and more of you become enabled to e-prescribe your controlled substances. So another mandate that unfortunately not many folks are doing. We're only at about 60%. So I'm going to talk about it today. There's also a webinar that you might want to join coming up. I can't remember if it's the next week or 2 weeks from now. But it's the Controlled Substance Prescription Monitoring Program, often called the PMP, the CSPMP. It is on our Board of Pharmacy website. So what is it? It is a state-run database that collects patient-specific prescription information at the time of dispensing. So what you do is you go in and look to see, to make sure folks are what prescriptions they've received within the past 12 months, so that you can determine if someone is doctor shopping, doing inappropriate prescribing, all those kinds of things. So beginning October 16th of 2017, the law was put into effect that Arizona prescribers were required to look at the CSPMP before a prescription for an opioid was prescribed. And how do you do that? The reason for it is it's required for medical prescribers under Title 32 who have a DEA license. And what you're required to do is review the preceding 12 months of your patient's record before you prescribe. Exceptions to reviewing the patient record are medical residents may register using the hospital DEA number and appropriate suffix. Prescribers must register, and I've given you the link there that you can go to register on the Board of Pharmacy site. And I've also given you the link on the bottom for registering and training. There are many good videos that the Board of Pharmacy has on their site that you might want to take a look at that will help you understand what you need to do. So please begin doing it. Even if you're doing a paper prescription and writing it, you are still required to check the PMP. There are several different ways that after you've registered and connected, there are 3 different ways that you can go in and check your patient's past 12 months. You can get there via the Board of Pharmacy's website, and I've given you the links there that you can go to, and you have to register and log in. And as I said, the Board of Pharmacy has some very nice little videos and webinar kinds of things on their site to help you get signed up and registered so that you can begin to check the PMP. Another way is that many of the electronic health records also provide you with a link to get directly from your EHR into the PMP on the pharmacy website. So you might want to take a look there and find out if your EHR vendor is available to do that, so you can go directly. Those of you that are Health Current HIE, Health Information Exchange participants, you can also do it through the HIE portal. So you might want to check the link on the bottom if you want to go and look at what's on the Health Current information so that you can do the monitoring through the Health Current. I promised I would give you a few barriers to EPCS so that you can pay attention and maybe look at what's going on with other folks that are experiencing barriers. Obviously, financial costs, you've known about it now since January 1 of 2018. So you have until January 1 of 2020. So you should be available, you should be aware of what your financial costs will be by now. Also remember that it takes time, so time costs you money as well. So you need to get into your vendor's schedule, and you need to also do your identity proofing and write your policies and procedures and get your workflows down. And keep in mind that your vendors will be experiencing backlogs as well, not only from Arizona practices and prescribers getting software, but also nationwide. Some other reasons why you may have a problem is lack of broadband. Your EHR system may not be certified for EPCS. The pharmacy may not accept EPCS, and that's a very small volume, less than 20 pharmacies. It's probably down to about 5 of them now are unable to do EPCS. That does not include the federal pharmacies. And I also promised to give you some of the benefits. It's safer, faster. You can do every prescription. You can do your regular legacy prescriptions as well as your EPCS prescriptions from one place. And it's accepted by nearly all of Arizona pharmacies, so they're happy to not get the paper from you. And it does comply with the state mandates and also DEA regulations. And there are some, if you're in the Medicaid Promoting Interoperability Program, that's the PI program, there's meaningful use measures that EPCS will help you gain. Some more benefits, probably the most important one is that errors can be reduced by 50% by using clinical drug alerts. That helps you a great deal with there. Another one that I think is important on this screen is prescribers' DEA numbers are no longer out in circulation on paper prescriptions. I think that's kind of important. It's also time-saving. It eliminates phone calls. There's just a multitude of reasons why EPCS is beneficial. Once you get over the learning curve, of course, then it will become part of your operation. It'll be fine. More benefits here. Also, if you're in the MIPS program, you will, that if the advancing care information category for e-prescribing helps you there. So be sure you look into those kinds of things as well. It will help you with those. I also want to tell you a little bit about the Click for Control campaign. We have a lot of options for you, a lot of help for you. On our Health Current website, if you can use the link here, there are fact sheets or articles. I can provide you with some slides if you want to include them in one of your staff meetings. I can provide you with some basic slides from this presentation as well as some others so that you can include them and talk about them. We also do phone support and email communication. If you send me an email with a question, I'll answer it. You also can call me, and my information will be at the end of this webinar. Please be, it's free, so don't be afraid to use it. And I always tell everyone, please don't struggle, call me. Because if you have the question, 9 times out of 10, someone else also has the same question. When you go to our Health Current website, you'll find several flyers that you can print out and hand to your prescribers so that they understand what's coming up and how to do it. Those will be of value to you. We also have a number of webinars. Today's webinar is Practice and Prescriber Readiness. That's the last one in this series on it. There's also another one, I've done one of these already, Understanding the New EPCS Mandates and Regulations, where we delve more into what's required. Today's webinar was more about practice and prescriber readiness. The one on October 16th is about the mandates and regulations. Then on October 30th, Lynn Curtis from the Board of Pharmacy will be doing a webinar focused entirely on the CSPMP, the Controlled Substance Prescription Monitoring Program. I urge you to attend that one. That is very, very good and gives you a lot more information than I did today about the PMP. And also another one, the last one on November 6th, will be on written and electronically prescribed prescription requirements. It'll focus on all of those kinds of things that are in the mandate, and there are a number of them.
That's actually been changed to November 20th.
Oh, sorry.
Sorry about that.
My slide is not up. My slide was not up to date there, so, and that's not Christine's fault, it's mine. should be November 30th. 20th, I'm sorry, 20th. I also want to let you know that we're going to be doing a webinar in our series about the Dr. First industry standard EPCS software. And the reason we're doing it is not because we are focusing on Dr. First and not because we're promoting Dr. First, but because they have a great system that will help you understand. If you watch their webinar, you'll understand what you'll have to be doing in yours as well, because they're all basically the same, just a different set of software. The most important part for me, anyway, that from questions that I've had, are the Dr. First offers a great smartphone option. So if you are a prescriber who prescribes from a hospital or a surgery center, or a dentist who does extractions at other offices, or even a GP who wants to be able to get a telephone call in the night from a hospital or wherever, be able to sit up on the side of the bed and prescribe from your smartphone, you might want to pay attention to Dr. First's webinar. There are also other systems that include a smartphone option, but Dr. First is one of them. I also want to let you all know that on November 12th from 1 to 4:30, we will have our 2019 HIE user group meeting. If you are an HIE, Health Information Exchange user, you will be able to attend that meeting. It's free. There's no cost to attend. You can click here to register. And I also want to let you know that November 13th through the 14th is our Health Current Summit and Trade Show. I think this is, what, the 12th?
12th year.
12th year. So those of you that want to attend that, there's the, you can learn more by clicking on this slide. Closing remarks, I'm not going to go through all of this, but please be sure to sign up for more of our webinars. Call me if you have questions or concerns. Be sure that you attend the CSPMP webinar and make sure that when you are prescribing a controlled substance that is an opioid, that you check the PMP. I also want to let you know that this webinar is presented to educate you and help you, but I encourage you to review and interpret the legislation and mandates yourself for your specific situations and needs. Don't just go basically for what was said here. Here's my name and how to contact me. And again, you can call me and ask me questions, email me and ask me questions. There's a place here where you can talk to someone about joining the Health Information Exchange. And for most of you on this line, it is free to join the Health Information Exchange. And you might want to just find out about it so you can find out if it would be important for you to learn. And that's what I have to tell you today, other than a few additional resources at the end that you will see when Christine sends it to you.
We have actually received a question, Connie. The question came through, is it okay to send MAT, MAT, or X's electronically? Can
yes,
you still do that?
You could do that. You may experience a few issues with trying to do it because it can be a compound. So you might have trouble, but you need to talk with your vendor about how to do it within their system is the best advice I could give you. But yes, you can do it.
Okay, terrific. If there are other questions, please use the chat feature, and we'll be happy to answer those as they come through. We'll give everybody just a few minutes if they're still thinking or formulating or typing those questions so we can get them answered on today's call. Thank you again for joining today's call as well. Again, the presentation will be emailed following the webinar today to those in attendance. The webinar is being recorded and will be posted up on the Health Currents website. Usually takes about 48 hours for that to come through. Again, I'm not seeing any questions come through yet. Happy to hold just a few more minutes and keep the line open for those that are using the chat box. Connie, you did such a great job. You've answered almost all their questions, I'm going to say. At this time, I'm not seeing any additional questions come through the chat box, so we're going to conclude. Oh, wait a second here. We do have one. The question is that this organization is a free clinic. They do not bill insurance. Their EMR is not a full EMR and does not meet the HHS requirements for eScribe. In Pennsylvania, they had received an exemption from eScribing because they don't have an EMR that qualifies. Does Arizona offer an exemption?
They do not. It's my understanding at this point there is not an exemption, and I've been told over and over and over again, there will be no exemptions for anyone that is prescribing a controlled substance that is an opioid. You are mandated to do it. Either you do it or you aren't able to prescribe. So if you want to call me about it, we can talk through some things that you might be able to do. For example, one of them would be a handheld or a standalone EPCS prescribing system that you could use. But as I said, I've been told that there will be no exclusions.
I think you also talked that there were some e-prescribing software packages or names of vendors that they could reach out for. Was that included in this presentation today?
It was included you would go to our website.
Our website?
It's on our website as well.
So we can certainly provide those to folks as well and have a link there.
Give me a call, and I'll be glad to help you walk through the process that you need to go through.
Absolutely, Connie, you're excellent at doing that. A lot of folks have reached out to you one-on-one and got those questions answered. So, again, don't hesitate to reach out to Connie Ide. She's the Director of Programs here at Health Current. She has extensive knowledge in the EPCS Click for Control campaign. So again, if you have questions, the presentation will be available to you. Connie's email, as well as the ERX at Health Current email gets to Connie, as well as her direct line. Again, I'm not seeing additional questions come through the chat box at this time. Again, thank you for participating in today's webinar. We will look forward to you to participate in the future ones. You can always go to healthcurrent.org/events to register for those. Have a wonderful afternoon, and we are going to conclude today's webinar. Thank you again for joining. Okay.